Good morning, everyone, and welcome to today's webinar from the Charity for Civil Servants, today in partnership with Dementia UK. The title for today's session, Let's Talk About Dementia. So if you're joining us online, welcome. Thanks for coming. You can see on the screen in front of you details of how you can ask questions or make comments as we go through the webinar. Any comments or questions you make are only visible to the host, and we will look to address those comments and questions towards the end of the session. If you're joining us by phone, again, welcome. You can interact with us by emailing webinar@foryoubyou.org.uk, and that email address will be monitored all throughout the broadcast. And again, we'll look to share those thoughts and comments with the host towards the end of the session. Again, if you're on the phone, or even if you're not and you want a copy of the slides, you can get those by going to our website, foryoubyou.org.uk. And if you click Digital Tools, and you'll see a button for Help and Advice Webinars, and you'll be able to download those there. Yeah, you'll also see later on today, after the webinar, we'll make the recording available from that same page on our website. So if you want to listen to it again or share it with colleagues, you'll be able to. Before we get started and I hand over to our host for today, Pam, just to tell you a little bit more about the charity in case you've not worked with us or come across us before. The Charity for Civil Servants, our vision is a lifelong community of people offering effective support for each other when life takes a turn for the worse. So we offer a range of services and support, which include things like money advice, support for well-being and mental health, financial support for those that are eligible, and also support for carers. We do that online through our digital tools, and also we have a team of one-to-one caseworkers who can work with you all across the country as well. So without further ado, I'm going to hand over to our host, Pam, from Dementia UK for today's session. Let's talk about dementia.
Good morning, and thank you so much for joining the webinar this morning. My name is Pam Kehoe, and I'm Northern, so I hope you can understand me. But I'm also a consultant Admiral Nurse at Dementia UK. I've been privileged to be able to work with people affected by dementia and their families for over 25 years, and I've been an Admiral Nurse for 18 of those years. I thought that I'd start this morning by telling you a little bit about Admiral Nurses. Many of you may not even be aware of who and what Admiral Nurses are. We're experienced nurses who specialise in dementia and provide the specialist support that families need. We work alongside people affected by dementia, their families and other caregivers, giving the one-to-one support, expert guidance and practical solutions that people need. And it can often be something that people can find difficult to find elsewhere. Admiral Nurses are continually trained, developed and supported by Dementia UK. So where can you find an Admiral Nurse? Well, Admiral Nurses work in a variety of settings. Dementia is all around us, not just in one location. Therefore, we now work in people's homes, we work in hospitals. We know that people who are affected by dementia and their families may find going into hospital a really distressing experience. So to be there to support them at that vital time is really important. We don't just stop when people leave their own homes. We also work in people's in care homes. We work in hospices and support people to be really well supported at end of life and beyond. We provide bespoke Admiral Nurse clinics in a whole variety of settings, including people's workplaces. And of course, we have the vital Admiral Nurse Dementia Helpline. So what is the Admiral Nurse Dementia Helpline? Well, it's the only nurse-led dementia helpline in the country at the moment. If you're caring for someone with dementia, or if you have any other concerns or questions, please do contact the Admiral Nurses on our free Admiral Nurse Dementia Helpline for specialist support and advice. You can either call the helpline on 0800 888 6678, or if you prefer, you can also email us on helpline@dementiauk.org. The helpline is now open from 9 AM till 9 PM from Monday to Friday, and from 9 AM till 5 PM on a Saturday and Sunday. But outside those hours, if you still want to contact us, you can always leave a message and an Admiral Nurse will get back to you as soon as possible. So in today's webinar, I hope to help you to start to think about what dementia means, but not just the word itself, the impact that dementia may have on the person, their family, and their friends too. Unfortunately, I'll only be able to briefly touch on things today, but hopefully you'll be motivated to want to find out more. Please do let us know if you have any ideas for future webinars by emailing webinar@foryoubyou.org.uk. I thought I'd start by showing you some people who have impacted on my life. There are lots of different faces here. How many people do you recognise? When you look at them, what thoughts do they evoke for you? Have any of the people in the photos had an impact on your life too? Well, certainly for me, I've had many positive memories when I look at this picture. The first record I ever bought was by David Cassidy. Everybody wanted a Blue Peter badge from John Noakes. I certainly did. I was so jealous. Lover or hater, the Iron Lady. There's The Greatest. And my own personal guilty pleasure. I always wanted to marry him. You guessed it, Columbo. There are actors, politicians, sportsmen, authors, people. But we know them, don't we? They're famous, rich and successful. We know them and believe that they had or have a great lifestyle. Some people have been looked up to, or otherwise, we all have our own opinions. But most have achieved a great deal in their lives. In some cases, we've followed their lives and experiences right through until they die. In fact, when I showed this to a student nurse recently, she said that all the people in the picture are legends. That's something that's really stayed with me ever since and helped me to think more about the people that I support. Although those people are all very different, with different lives and different circumstances, they all have one thing in common. Dementia. Because we feel that we know those people, we don't automatically think of the word dementia. Likewise, it's important to recognise that each person with dementia is a legend to those who've had the opportunity to share their lives too. Who are they? Well, they're their families, their friends, their neighbours, their work colleagues. This is because dementia really is everybody's business. But what is dementia? Well, the Alzheimer Society have defined dementia as a collection of symptoms, including a decline in memory, reasoning, and the ability to communicate, and a gradual loss of the skills needed to carry out daily activities. These symptoms are caused by structural and chemical changes in the brain as a result of a physical disease such as Alzheimer's. It's not just about memory loss. But dementia doesn't just stop there. Dementia is an umbrella term for a range of progressive conditions that affect the brain. It's been identified that there are over 200 subtypes of dementia, but the 5 most common are Alzheimer's, vascular dementia, dementia with Lewy bodies, fronto-temporal dementia, and mixed dementia. This means that the person has 2 or more different types of dementia at the same time. The brain is made up of nerve cells that communicate with each other by sending messages. Dementia damages the nerve cells in the brain, so messages can't be sent from and to the brain effectively. This prevents the body from functioning normally. Regardless of which type of dementia is diagnosed and what part of the brain is affected, each person will experience dementia in their own unique way. Dementia can affect a person at any age, but it's more commonly diagnosed in people who are over the age of 65. A person developing dementia before the age of 65 is said to have young onset dementia. So let's look at some of the most common types of dementia. Alzheimer's type dementia is the most common type of dementia in the UK, with around 60% of all diagnoses being Alzheimer's. It's a physical disease caused by changes in the structure of the brain due to a build-up of plaques and tangles, and this can result in a shortage of important chemicals that help with the transmission of messages. Alzheimer's type dementia affects 5 main areas: people's memory, people's cognitive ability, their insight, language, and visual spatial awareness. The symptoms, which tend to develop gradually over time, may include difficulty with remembering recent events while having a really good memory for things that happened some time ago, poor concentration, inability to recognize things, reduced ability to relate to events to time, poor organization skills, confusion, disorientation, slow, muddled or repetitive speech, losing the ability to perform everyday tasks such as cooking, paying the bills, going to the shops and buying the right things, or even putting on a pair of tights. There may be problems with decision making too. So for example, if somebody is given a menu with lots and lots of choices on it, it may be very difficult for the person affected by dementia to make a choice and may probably just choose the last thing that they see. Medication is available to help slow the progression of Alzheimer's type dementia, but it doesn't prevent or cure.
Pam, we've also got joining us Linda, who's our head of caring and health services, and she's got a follow-up question for you.
Pam, I just wondered if you could just explain a little more about what visual spatial awareness actually entails. What is it?
Certainly, yeah. Visual spatial awareness is the relationship of what we see and what we perceive around us. So, for example, someone might see something and perceive it as something completely different. An example of this is if you've got black squares on a floor or a carpet, the person affected by Alzheimer's type dementia, in fact some other types of dementia too, might actually perceive, they'll see the black square but perceive it perhaps as a hole, or they may even see it as a step. So you may actually see that person either stopping dead at the beginning of the square because they perceive it as a hole, or trying to step over it. And it's really important to recognise that. Another example is if you've got blue flooring, especially if it's lino and it's shiny. In hospitals, when they buff the lino, the person affected by dementia might actually perceive that as water and be quite frightened by it.
Thanks, Pam, that's really interesting.
I'd just like to show you two images of two brains. The brain on the left is a healthy brain, but as you can see, the brain on the right, which I've highlighted, shows signs of shrinkage and leaving gaps within the brain. This brain belongs to someone with Alzheimer's type dementia. So moving on to vascular dementia, well, that's known to be the second most common type of dementia. However, consultant psychiatrists at memory clinics are now identifying vascular dementia much more commonly over recent times. It's caused by problems in the supply of blood to the brain, commonly due either to strokes or a series of very small strokes. These are called transient ischemic attacks, and some people might call it TIAs. This causes areas of cell damage within the brain. Changes in the person's condition are much more sudden as a result of these TIAs, or even a larger bleed. And then, as this settles down, the condition plateaus. Unfortunately, the damage caused usually means that the person doesn't function quite the same way as they did before. The signs and symptoms of vascular dementia depend on which area of the brain has been affected. Memory problems may not be an issue initially if this area of the brain has not been damaged. Language, reading, writing and communication can also be affected when somebody has been diagnosed with vascular dementia. Our lifestyles can have a massive impact on the risk of developing vascular dementia. What we eat, how we eat it, drinking alcohol, how much we exercise, smoking, being overweight, and taking recreational drugs can all influence on the risk of developing vascular dementia as we get older. Dementia with Lewy bodies is also known as Lewy body dementia. It's both the same thing. People diagnosed with dementia with Lewy bodies have a build-up of clumps and proteins in their nerve cells in the brain, and this is known as Lewy bodies. This damages the way the nerve cells work and how they communicate with each other. Like other types of dementia, dementia with Lewy bodies is a progressive condition that can affect movement and motor control also. A person with dementia with Lewy bodies may be more prone to falls. They may have tremors, which are similar to Parkinson's symptoms. They may have trouble swallowing. They may shuffle when they walk. They may experience disrupted sleep patterns, and this is usually due to having intense dreams or nightmares. They may have visual and auditory hallucinations. In other words, they may see or hear things that we can't, and this is due to the nerve damage. Memory is often less affected, particularly initially, than other types of dementia, but a person may experience sudden bouts of confusion, which can change on an hourly and even less basis. Fronto-temporal dementia more commonly affects younger people, and this is usually in the age range of 45 to 65 years. Initially, again, this is something that is often very difficult to diagnose and may also be misdiagnosed as something else. The region of the brain most affected is the frontal fronto-temporal part of the brain, which is the front part of the brain. Temporal dementia can affect behaviour and personality, which can in turn cause disinhibition and inappropriate social behaviour, losing that ability to recognise what to say and when to say it. I've personally been subject to this, and a patient with fronto-temporal dementia once said to me, "Well, you've been eating too many pies." He was quite correct, but it's not something that people usually say. Eating patterns can also be affected, with people suddenly binging on food, especially sweet foods. This form of dementia can be confused with depression, stress, anxiety, psychosis, or obsessive compulsive disorder, especially if the person doesn't have the opportunity to be referred to a memory clinic for specialist assessment. Some people may experience a loss of understanding of the meaning of certain words as well. This is known as semantic dementia. So, with those said, let's look at some of the more common facts about dementia. There are currently around 850,000 people in the UK with dementia today. I would argue that that is only the tip of the iceberg, and those are people who have actually had the opportunity to be diagnosed correctly. It mainly affects people who are over the age of 65, as I've said previously. So around 1 in 14 people in this age group have a diagnosis of dementia, according to the Alzheimer Society. But the likelihood of developing dementia increases significantly as the person gets older. 2/3 of all people with dementia live in the community within their own homes. I think it's fair to say that most of us would choose to live in our own homes if we could, and receive the support to be able to live there and remain there until we die. I call this scaffolding around the person to enable them to stay well. But this is no different, for people with dementia, is it? In general hospitals, around 1 in 4 hospital beds are occupied by someone with a diagnosis of dementia or a probable diagnosis of dementia. Dementia UK are now working to increase the number of Admiral nurses in general hospitals so that they can enable the staff and families to support those people with dementia who are admitted or attend A&E, so that they have the very best experience whilst they're there. We also support John's campaign, which enables family carers, where they choose to be with their families, to continue to support them whilst they're in hospital. Dementia is a disease of the brain. It's a physical condition, and it is not a normal consequence of getting older. And whilst dementia is more common in older people, as I said, it can affect younger people too. Although younger people are more often affected by the more rarer types of dementia. There are more than 42,000 people in the UK who are under the age of 65 with a diagnosis of dementia. So how does dementia affect us? Well, if you take nothing else away today, remember that there is no one size fits all for people who are affected by dementia. A very influential consultant who I worked with for many years always says, when you've met one person with dementia, you've met one person with dementia. How the person is affected by dementia can be affected by their unique life experiences. We all have our own unique life experiences. We're all legends. Their environment, and how people respond to the person affected by dementia, as well as the physical changes within the brain itself. Although each family will experience their own unique journeys, the journey always starts by getting that vital diagnosis. If you're concerned about your own memory, or you're worried about changes you've noticed with the memory, personality, or behaviour of someone who's close to you, it's really important to consult a GP as soon as possible so that an accurate, timely diagnosis can be made. In the majority of cases, the GP will refer the person with symptoms suggestive of dementia to a memory service, maybe a clinic or a specialist consultant. However, before they do this, they should assess whether the person has an underlying treatable condition, for example, depression, vitamin B12 deficiency, or abnormal thyroid function, which can all mimic the symptoms of early dementia. In addition, they should also take blood tests, a chest X-ray if that's necessary, and arrange for a scan of the brain, and also take a urine sample to rule out any other physical issues that the person may have which is affecting their cognitive ability. There's some evidence that keeping active and involved in people's social experiences can help a person with dementia to retain their abilities for longer. Regular exercise in particular seems to slow the progression. The person affected by dementia and their families should also try to eat healthily, get enough sleep, and take medications that are prescribed. They should also not smoke or drink too much alcohol. It's also important for the person to have regular checkups. Check the person's eyes, ears, teeth, and feet. They should make sure that they're up to date with vaccinations. So, for example, flu vaccinations if possible, and to keep a careful eye on any other long-term health conditions. A sudden change in the person's abilities or behaviour could indicate that there's a physical or psychological health problem or an infection taking place. Each person experiences dementia in their own unique way, and it's always important to remember that the diagnosis doesn't mean that they're a different person than before the diagnosis was made. They are still those legends that you've always known and loved. Try to see the person, or think of them as the legend with dementia, and not the person who's been taken over by dementia. One way of being able to uphold who the person is by using their life stories. Our own life experiences shape us as individuals, and this helps others to understand who and what we are as a person. People with dementia sometimes need help to communicate important aspects of their identity, especially as their journey continues, like their background, their interests, who and what is important to them. We might get that wrong. And this is due to problems with memory loss and communication problems. Life story work is an activity in which the person with dementia is supported by staff and family members to gather and review their past life events and start to build a personal biography. It's not just a form-filling activity. It's a living and breathing document that stays with that person as their journey continues. It's used to help the person understand their past life experiences and how they've coped with events in their lives. Life stories can help people with dementia share their experiences and enhance who they are as a person, their sense of identity. This is especially useful as the journey progresses and they may begin to experience more difficulty in sharing this information themselves. The life histories can go with the person and continue with the person until they die. Life story work can help encourage better communication and an understanding of the person's needs and wishes, especially when they can't communicate them themselves. This can inform their care and ensure that it is provided in the really most positive and person-centered way that we can. It can also help the person develop closer relationships with family carers and staff through sharing their stories. Most importantly for me, it enables us to remember the person or the legend and not the problem, the dementia. From the moment that we wake up in the morning to the moment we go back to sleep at night, we're communicating. What we say or communicate can be either verbal, which are our words, or non-verbal, our behaviours. Surprisingly, only 7% of what we say is done verbally. 93% of what we say doesn't come out of our mouths. It's therefore really important that what we say to the person with dementia verbally is also consistent with what we're saying to them non-verbally. For example, the tone of voice that we use, what our posture's like, how we nod, and the appropriate use of touch. Now, if we've done some life story work with the person, we'll know whether touch is appropriate for that person or not. Everything that we do should be seen as an opportunity to communicate with the person. This can be a smile, a wave, saying hello when we walk in a room. No matter how busy we are, we can do this because all contact is really significant. Even if the person has an advanced dementia, always assume that the person understands what is being communicated in their presence, because this can lead to distress for them if we don't. So when we're communicating with the person, use sentences with a simple structure that doesn't have too much information in rapid succession. Sequence what you want to say to them and cut it down into bite-sized chunks. You can still say the same thing and the person can understand it so much better. Be aware of the tone and volume of your voice, and remember that the person is an adult, so remain respectful. We don't need to talk to them as if they're very young children. Most importantly, use your knowledge of the person when you engage in conversation with them. For example, using their likes, their dislikes, their favourite pastimes, and do they have a hearing or sight impairment that might be affecting their ability to communicate. What we shouldn't do is never do something else at the same time as talking to the person, because this could say to them non-verbally that you're disinterested. Don't give inappropriate replies, even in jest, as this could be hurtful if they misinterpret it. If the person is talking, try and give them time to speak and try not to finish the sentences unless they clearly indicate to you that they want some help. And don't be dismissive, disbelieving, or, importantly, don't argue with the person. Try to distract or validate their feelings instead. It really is about supporting the person to live as well as possible.
Pam, can I just ask there, when I began nursing hundreds of years ago, we were taught to bring people back to our reality rather than going with their reality, and I know the teaching has changed around that. Can you tell us a bit more about how we can do this, how we can distract or validate without lying or causing distress?
Yes, certainly. I did my nurse training with Florence Nightingale as well, and it was very different back then. There are different thoughts and different ideas around that, but I think I truly believe that it's important to enter the person's world rather than to drag them into our world. With that said, I personally use I don't believe that going along with a person is necessarily the correct way to do it. And if you do choose to do it that way, do it with caution, because the person may pick up that you're lying to the person. So, for example, if the person says, I'm waiting here for my mum to come and pick me up. If you say, oh, well, she's gone to the shop and she'll be back in a little while, whilst that might pacify the person for a couple of minutes, they will still be looking for the mum. And you're not actually meeting that need. They're thinking about the mum and you're not actually meeting that need. Likewise, telling the person, well, your mother died 30 years ago. That can be like telling the person for the very first time and cause real distress, increase the risk that the person may argue along with you, or alternatively, the person may be just too distraught to be able to take that on board. But 5 minutes later, they may be looking for that for the mum again. I personally like the use of validation. Validating is about recognising the person's feelings and thoughts and enabling the person to talk about the thing that they're thinking about. So if we use the person's mum as an example again, it's like recognising that they're thinking about the mum. So I would personally say to the person, you must have loved your mum very much. Tell me about her. And then start to have a conversation with them around the mum, because that's who they're thinking about. And I would use the past tense. So what was she like? You know, where did you used to go? What was the favourite thing that she used to make for you? So you're actually fulfilling that need. And that to me is distracting and validating the person and their thoughts.
Thanks, Pam.
So when supporting a person with dementia, never assume that what we see is everything that's going on. Just like icebergs, we often can't see what the person with dementia is experiencing personally and within themselves, and we merely see the result. So, for example, how the person is behaving as a result of what we cannot see. If the person has visual spatial problems and is becoming distressed, we may see that the person's agitated, but we don't know why the person's agitated, or we don't recognise why the person's agitated. So if the person is behaving in a way which is difficult to understand, do try to think about what may be affecting them, which they're not able to explain or articulate. Examples can be, are they in pain? Are they hungry? Are they frightened about something? Do they need to go to the toilet? Are they feeling disorientated or lost, even if they're in a familiar place at the time? Or do they just need a hug? So here are some key messages when supporting the person with dementia. Try to focus on feelings and try and put yourself in their shoes, into their reality. Try to help create a sense of security and familiarity. See all behaviour as having meaning and attempt to communicate something to you. provide opportunities for meaningful activity with the person, using their life experiences as a key. And importantly, see the person, not the dementia.
Pam, just picking up on your point there about creating a sense of familiarity and security. Many carers I've worked with have expressed how distressing it is when the person with dementia doesn't recognise them. Have you got any advice for dealing with that situation? How they, you know, what they can do, or some just words of golden nuggets that you can give?
Yes, certainly. Well, from my experience, what I've found that even when somebody doesn't actually recognise the person as who they are, they often have those feelings of feeling safe with the person, even if they can't articulate that. So for a family member supporting, or a paid carer supporting somebody with dementia, use what you know about the person. If the person's distressed, use things that you know would help support them. So for example, it's okay, I'm here, I love you, you're safe, using words that can enable the person to feel safe, and using words that the person recognises that you would use for them. Ultimately, the person who's affected by dementia, although doesn't articulate it, knows that the person is somebody who's important to them and they feel safe with them.
Thanks.
Before finishing today, I briefly wanted to raise the awareness of delirium. Delirium is a condition which can cause someone to become suddenly confused. This is over hours or even a day. This may be the result of illness, surgery, or with the use of some medication. More than half of patients who are admitted to hospital may experience delirium at some time during their stay. Delirium is a treatable condition and may coexist at the same time as dementia. However, it's sometimes really difficult to recognise in people with dementia because it can have similar symptoms such as confusion and difficulties with thinking and the ability to concentrate. It can last a few days, weeks, or even up to 4 months, but it may take longer for people who are affected with dementia to recover. There are 2 types of delirium. People with a hyperactive delirium can experience increased confusion, and this fluctuates throughout the day, and they can feel agitated or restless. People with a hypoactive delirium may feel more sleepy and be less responsive, and this in turn can lead to malnutrition and dehydration if it's not identified. Other symptoms of delirium can include seeing things that are not there, or having very vivid dreams. They may have difficulty in focusing attention, and they may have problems with following a conversation. In the more extreme cases, delirium can be fatal, so it's vital that the person receives treatment and recognition as soon as possible. So finally, in conclusion, dementia is a term used to explain a collection of symptoms which affect the brain. There are many different types of dementia, and the brain suffers damage over time. The way that we support people enhances their sense of well-being. And particularly with vascular dementia, what is good for the heart is good for the head. And remember, think delirium if changes suddenly happen. Dementia really is everybody's business. And finally, when you've met one person with dementia, you've met one person with dementia. So thank you for taking the time to take part in the webinar today. If you found that you want to know more about something in particular, please do email your thoughts and suggestions to webinar@foryoubyou. So it's over to Linda to tell you a little bit more about how the charity can help.
Thanks, Pam. And before we do that, just to say if we've got some questions coming in, which is great, and we'll pass those over to Pam shortly. So if you have anything to add, please either do so online, if you're online on the console, enter your question in the box, or if you're on the telephone to webinar@foryoubyou.org.uk, and we'll try and get to as many of those as we can. Over to Linda.
Well, I'd just like to firstly say thanks to Pam. That was really, really interesting and informative. So thanks for that, Pam. And I'd just like to briefly remind people about the support available through the charity. So I'm not going to go into depth, just to make you aware of that we have our carers passports and our carers statements and our emergency plan. So, you know, do think about getting your emergency plan in place if you're caring for someone. If you're new to caring, we can provide you with information and support. We have our wellbeing support that carers can tap into, and relationship support there too. We have our Law Express legal app, and we can offer general legal advice as well through telephone calls with Law Express. We have our money and debt advice service, where you can have an appointment with one of our money advisors. And for the wellbeing support and for the money, we have our online digital support that's there available on the website, and our chatbots. And of course, we have our financial support. So if you have additional costs related to your caring, such as additional fuel, travel costs, higher heating bills, things like that, if there's some technology out there to support you as a carer that you think would be helpful, please do get in touch with us. And also around getting a break for caring, all applications are assessed on their individual circumstances. So just go to the website and click the Apply for Help button. Thanks very much.
Thanks, Linda. And just to say, before we go over to the questions, just a quick plug for the charity. Obviously, we can't do what we do without your support. So whether you can make an online donation, volunteer with us, or just sign up so that you know what we're doing, details are on the screen and also on the slides as well. So we've got a few questions, which I'll just come to, and we'll put to Pam. Pam, the first one I've got here is from a colleague in Wales who has a family member who has a diagnosis of vascular dementia. But since diagnosis, there's been no dementia-related medical appointments arranged by the GP. And the GP makes the person feel like they're pestering them. Are they able to request an Admiral Nurse themselves?
I don't actually know exactly where you live in Wales. We do have a growing service in Wales. Unfortunately, there are only around 280 Admiral Nurses in the whole of the country at the moment, in the whole of the UK. So I can't guarantee that there is going to be an Admiral Nurse service there. But what I would suggest is that in the first instance, you contact the Admiral Nurse Dementia helpline that anybody in the whole of the UK and further can actually use on 0800 888 6678, and you can speak to an experienced Admiral Nurse. You can access that service as frequently as you want, and they will be able to check if there's a service that you can access who's near to yourself. The service is open 7 days a week, Monday to Friday 9 AM till 9 PM, and Saturday and Sunday from 9 AM till 5 PM. I do actually go on the helpline from time to time, so I might have the privilege of speaking to you.
Brilliant, thanks, Pam. And the details of the helpline are also on the slides as well as on the Dementia UK website, of course. Next question we've got: when someone doesn't recognise you, do they know that they're not recognising you? I.e., do they think that they should and get agitated as a result, possibly, or do they just simply not know who you are at that time?
That's a really good question, and a question that we could have a lot of debate about, really. As I said during the webinar, each person experiences dementia in a very, very unique way. Whilst one person may become quite agitated, that they know that something's not quite right, and they know that they should know something, they may react like that. But it's important that we recognise the person and we recognise their uniqueness. We don't argue, we don't say, you should know who I am, you should know who I am. Instead, use the distraction, use the validation, I care about you, tell me about what you're doing. Use the knowledge of the person and use really important words that can support that person. I love you lots, you're safe with me, and try to gently guide the person to recognise who you are by using the appropriate use of reminiscence too. It's a very, very difficult question to answer because, like I say, when you've met one person with dementia, you've met one person with dementia.
Thanks, Pam. Next one was just about the life stories that you mentioned earlier. The question was whether there's templates or guides available that might help people to start putting those together.
Yeah, there's lots and lots and lots of different templates. Personally, I think they're okay as a guide to, but you know, I keep saying that everybody's completely unique. And so each person's life storybook or life story, as I prefer to use, is completely different. Why I also believe is the life story doesn't start at one point and finish at another. It should continue. It's a living and breathing document until the person dies and beyond. And what I use when I'm supporting somebody with their life stories and their life histories is I use a big lever arch folder, and I use poly pockets and things that occur we can then add in at the as the person's life continues. I do use like templates, and Dementia UK have one that you can download, and also the Life Story Network have lots and lots of really important information on theirs as well. But remember that each person is unique and each person's life experience is unique, so their life stories should be unique as well.
Thanks, Pam. And Linda, I know you're interested in kind of looking at what information we can offer on the Charity of Civil Servants website. So might we include that kind of thing?
Absolutely, yeah. That's something I'm looking at now, to get some information about life story work onto our website on the dementia section.
Great. And the final one's a comment rather than a question. Someone whose father was admitted to hospital with sepsis and a severe urine infection. That was treated, and what rang true was your description of delirium, and that they had pushed for a dementia diagnosis because this state of delirium had continued for a number of weeks, and so they'd kind of disconnected it from the original reason for the hospital admission. So they were kind of thinking, is it actually perhaps now possible it was delirium, and that pursuing a dementia diagnosis wasn't the right thing after all?
I think it's important to keep an open mind, really. Sometimes when somebody develops a delirium, it can be a precursor and for somebody recognising the early symptoms of dementia. So what I would do is I would ensure that the person does have the opportunity to be assessed if necessary, because it can take up to 12 weeks anyway from asking for a referral to actually accessing the memory clinic anyway. But do keep in mind that the person may, their ability may return to how they were before they developed the sepsis. Sepsis is a very, very serious condition, and it may take your dad a long time to get over that, especially if he's older now. So just keep an open mind, but talk to your dad's GP and think about whether he does need a referral to the memory clinic anyway, because it's better to be safe than to be sorry. But it can take up to 16 weeks for the delirium to subside after the initial cause of the delirium has been treated. So just keep an open mind.
Pam, that's great. That's about all we've got time for this morning. Thank you so much, Pam, for joining us here at the charity, and thanks also to Linda for organising this and making it all happen. And thank you to everyone who's joined in, whether you've listened or asked a question. It's very, very much appreciated, and I hope you found it useful. As I said at the beginning, the slides are available on our website. There are a number of handouts that are also associated with the session. If you're online, you can access those from the console on the right-hand side of your screen. If you're on the phone, they should be available on our website from the webinar page later on today, and you can access them then. The recording of this session will also be available from our website at the end of the day, so please feel free to share. Finally, we will be sending out an email to everyone who's attended to ask for your feedback. So please fill that in. That really helps us to understand what we can do to do more of these webinars and also to improve the content for the future. Thank you once again, and we hope to see you again another time.